Hi, I'm Jennifer Johnson. I'm the Executive Director of the CHSSN. I'm here today to start off the 25th anniversary celebrations to show you the impact our organization has had on communities across the province in their efforts to improve access to English language health and social services. We're going to go on a trip to 3 of our organizations in the Gaspésie and Thetford mines, and they're going to talk to you about how working with CHSSN has made a difference in their communities. But first, we're going to start off by talking to some of the founders and hearing their vision for the CHSSN.
Hi, Jennifer.
How you doing?
I'm doing well. Yourself?
Good, good.
I'm Richard Walling. I'm the Executive Director of Jeffrey Hill Community Partners, and we're in the head office site of both Jeffrey Hill Community Partners and CHSSN.
So how did it get started here in Quebec City?
I think it got started because there was a recognition by the community that it wasn't really accessing all the services that it needed from the public health and social service system. So we started in 1991 with seniors, and then we expanded to families in 1996, all with that notion of bringing the community and the public system together to provide services to the English-speaking population in the region.
Now we've taken it to 23 different organizations across the province.
To look at the network today and impact it's having on those vulnerable English-speaking people across the province is just amazing.
Yeah. And with that, I was on my way to begin my trip across the province, starting right here in Quebec City with 2 more CHSSN founders. I wanted them to share what the vision was for CHSSN when it was founded in 2000. Through the years, we have built a sense of community by traveling to the regions using primarily planes, trains, and automobiles. So what better place to meet them than as they arrived at the Quebec City train station? I'm here with Jim Carter, the Senior Policy Advisor for CHSSN, and Ron Creary, President of CHSSN. Jim, you put this all together. You were the architect. How did you think this up, and what inspired you?
We started on the belief that when communities are organized, they can influence, if not change, the systems that affect their lives. So we built CHSSN with a single purpose of improving access to services and improving health outcomes in our communities.
We had to make some decisions from the start as to what kind of organization we want to be. Back then, if you look at other provincial organizations, most of them were involved with advocacy, but we decided to go another way. We would not be advocates as such. What we would do is we would organize our local communities.
And I think one of the amazing testimonies to the success of what we've done is that there are 10 organizations that were created. Areas that never had a community organization now do.
We have continued to just increase the number of them, and the ones that started with us are still doing well, flourishing.
You know, we have not looked back in 25 years and we have not stalled in our purpose. So I think we are there to stay.
I'm going to go visit 3 of these networks to get firsthand the impact of CHSSN on their growth and development.
Now that we have told you how we have viewed the last 25 years, it might be nice to hear how they have viewed the same period of time.
We'll have to see.
We'll have to find out.
I was now on my journey to show the impact of the networking approach to improving access to health and social services in English in communities across Quebec. My first stop was MCDC in Thetford Mines of the Chaudière-Appalaches region. They were one of the first communities CHSN worked with to start a community-based approach to better access. Richard Walling joined me for this visit because we came to this community together all those years ago to get the ball rolling. Richard, you and I came here in probably 1996 to start community visioning exercises based on what we'd learned in Quebec City. And Peter, you were the community organizer.
We set up, 4 committees, I think it was? One was communication, establishing a foundation, housing, and health.
We said, don't think of what you think is going to happen. What do you want to happen? Instead of being observers of your decline, become participants in your future and help define that future as to what you would like.
So there's lots of partnerships that we do actually with the school. And I think that was the idea of MCDC, use the school as a hub. Happy to say the principal is on our MCDC board, facilitates a lot of partnerships, a lot of initiatives for us.
When NCDC was created, we were struggling to find money for one employee. How many employees do you have today?
We're 10. So we have an office in Levy that we opened up in 2019. And we're 7 here. We have about 6 different programs, from early childhood, from senior wellness. So thanks to the support of CHSSN, the staff, we've grown basically from 0 to 100 years. We're supporting every age group.
Thank you so much for sharing your stories, your experience here in Thetford Mines. I'm going to get on the road and I'm going to go to the gas bay and talk to 2 of the networks in gas bay as well. I really appreciate you sharing your time with me today. Next, I was off to the town of Gaspé on the tip of the coast to visit with Jessica Sinnott, the executive director of Vision Gaspé Percé Now. Vision asked for CHSSN's help to get the community started on improving access over 20 years ago, and the public partners played a key role in its success. We got invited to come to Gaspé by some community leaders, and we helped them put together a community profile. A couple of years later, they incorporated as Vision Gaspé Percé Now. When you came back to the community, what did you learn about Vision?
I think a lot of the focus in the beginning was really working on the issues of accessing English language services at the hospital and in the health system. And then, of course, there was the seniors. In the beginning, we needed CHSSN a lot in terms of putting the whole structure together, trying to find funding for different programs, learning how to develop the partnerships. And now it's transitioned through the years. You've taught us so well, I guess you could say. CHSSN, I think, has been able to step back a little bit. We've developed a very solid structure and we have really dedicated employees.
We're going to go and have a conversation with Connie Jacques.
She definitely is a champion for the English-speaking community.
My name is Connie Jacques. I used to be President Director General Adjoint of the CIS SPZ. I've seen a big change over the years of people feeling a sense of pride in being able to service the entire community.
Your presentation that you made at our CHSSN event, I think, was a real catalyst for other communities to find that champion and making sure that the community wasn't left out or forgotten.
We made sure before I left to retire that we had champions already in Clan. So we had someone whose sole purpose is to make sure that we offer services for Anglophone and First Nation communities. So that also makes sure that we had people strategically at the right place.
I don't know that Vision would have been able to get where we are without CHSSN support.
I'm now visiting with CAZA in New Carlisle on the Gaspé Coast. Alan Richards, the executive director, and Kathy Brown, a past executive director of CAZA, are joining me. All of the NPI networks are pioneers. They all explore new frontiers, take risks, and innovate in order to adapt their regional context. One of the biggest stories with CAZA is the creation of 2 programs, the Senior Wellness Center and the Patient Navigator. Kathy, you were there when the Senior Wellness Centers were started.
There was a group of seniors in a small community called St. Joe's Cascapedia who they felt they had no contact with. We sat down and come up with the plan. In the Francophone community at the time, there was a thing called Centre de Jour. So he wanted to know if CAZA would partner with the CIS to build a Centre de Jour for English-speaking seniors in that specific area. And the program was very successful. We were at maximum capacity. And then after a year, the CIS reevaluated the program and said, listen, I'm really sorry, but these seniors are in too good of health. And they don't fit into the profile of what we would call someone who needed the services of a Centre de Jour. So we're like, oh my God, can't cancel this program. As seniors are getting out of their homes. They're doing lots of different activities. We're bringing in health professionals. So that's where CHSSN came in. I picked the phone up and gave Jennifer Johnson a ding-a-ling. I met with partners at Jeffrey Hale, and they had a seniors day center going there at the time. We sat down and talked about how we can duplicate that service. Came down to kick off the Seniors Wellness Center, the very first one. And then the news spread, of course, in other communities. And we went from one Seniors Wellness Center, then we slowly picked our population.
We're still in 9 different communities, so we have 11 centers. This is just an opportunity, one, for them to get out, to be active, to see other people in their age range, to be social, to break down that isolation.
Keeping them connected, helping them learn what services are available.
And creating a buddy system as well, right? So when you get 15 or 16 seniors in a room, when they leave the room, the story is not over.
It's amazing how your senior wellness centers have inspired up to 125 senior wellness centers across the province. Just think about how many people that's touching.
In 2006, CASA asked Canadian Heritage for project funding to do an extra regional project. Because we've heard in our communities that when patients leave this community, this region, for health services, they were really struggling with English services. And yet the system told us that that wasn't true. We hired a consultant who literally went to different hospitals off the coast and asked for service in English. We found that the lack of English services throughout Quebec outside of the Gaspé were atrocious. So I phoned CHSSN and said, we got a problem. And from that, I'm really, really proud that the patient navigator was the result.
Alan, Gaspé now has its own patient navigator.
I interviewed Jim for a tourism job. He knew nothing about tourism. Yeah, wasn't going to get that job, but he was a former paramedic, perfectly bilingual, newcomer to the area. And as I was driving home from the interview, I was thinking, wouldn't he make a great patient navigator?
Here we are today. We're negotiating with the provincial government right now to finance for 5 years patient navigators in multiple regions across the province of Quebec. And you know what I love about this project? It incorporates everything about what CHSSN has been trying to teach communities since the very beginning. Build your knowledge base, become a part of the solution, make partners, use the strengths of your partners to respond to the needs of the population. We came into this business kind of taking a model in Quebec City that was working, trying to figure out why is it working and how can we bring that to other communities across the province. We learned in the process ourselves. We didn't get handed a manual. We had to kind of create the manual and finding champions in your partners.
So what are you going to do in the next 25 years?
Oh, wow. We gotta make sure that our communities stay vigilant about the rights that they have to receive services in English. I think it's gonna be challenging in the next couple of years for sure.
The work's never done.
No, the work's never done.
We should have a sunset that we could walk off to.